We are going to talk about the tuberculosis of the joint. So we'll study the pathophysiology, the clinical features, the stages, and finally the investigation and the treatment part. So coming to the pathophysiology, tuberculosis of the hip joint most commonly occurs through the hematogenous route spreading from some primary focus in some other part of the body. It most commonly involves the hip joint, and in the hip joint it involves the acetabulum part most commonly. It also involves a knee joint. Coming to the clinical features, the patient will have constitutional symptoms of tuberculosis like cough, night sweat, fever. Apart from this, he will have painful limb. His gait will be ataxic. There will be shortening of limb and deformities will be seen. Coming to the stages, there are three stages. The stage of synovitis, second is the stage of arthritis, third is the stage of erosion. In the stage 1, in the stage of synovitis, there is effusion in the joint space. The capsule is distended. The hip joint tries to occupy the position of ease, so it goes into flexion, abduction, and external rotation. You will find an apparent lengthening of the limb in this stage. Then comes the second stage, which is the stage of arthritis. The erosion of the articular cartilage starts here, so due to which the powerful muscles of the hip joint starts undergoing spasm. As a result, there is flexion, adduction, and internal rotation, and there is an apparent shortening of the limb. And coming to the final stage, which is the stage of erosion, you will find the cartilage is completely destroyed. Even the head and acetabulum is eroded, and you will find a true shortening here. Coming to the investigation, when you will do an X-ray of the hip joint, you find a triad here, which is known as femistal triad. In femistal triad, you see juxta-articular osteopenia. In the periphery, the osteocytes are reduced. You find a peripheral erosion and gradual narrowing of the joint space, which is different from the septic arthritis, where you find a uniform osteopenia, you find a central erosion and significant narrowing of the joint space. Coming to the treatment part, in treatment, we give the anti-tubercular drug therapy, and if there is a deformity and it is in the late stage, we go for excision arthroplasty to remove the fibrous head. If it's not possible, we go for arthrodesis or arthroplasty, which is the complete hip replacement. So this was all about tuberculosis of the hip joint. Thank you for watching.